So now we're going to talk about hypotonic hyponatremia. We started by talking about isotonic hyponatremia. We talked about hypertonic hyponatremia. Now we're going to be talking about hypotonic hyponatremia. Now, remember we said that hyponatremia can be classified based on osmolarity of the body fluid. Now, the osmolarity of the body fluid, when you is classified, hyponatremia is classified into hypotonic hyponatremia, hypertonic hyponatremia, and isotonic hyponatremia. So now we have talked about hypertonic, we have talked about isotonic. We want to now talk about hypotonic hyponatremia. Now, in hypotonic hyponatremia, this one specifically involves the classification of hyponatremia based on volume status. Remember, we said when you are classifying based on osmolarity, you classify into isotonic, hypertonic, and hypotonic. Then, when you now want to talk about hypotonic hyponatremia, now this hypotonic hyponatremia is classification of hyponatremia based on volume status. So, under hypotonic hyponatremia, you have hypovolemic hyponatremia, you have euvolemic hyponatremia, and then you have hypervolemic hyponatremia. Remember again, I said you have hypovolemic hyponatremia, euvolemic hyponatremia, and hypervolemic hyponatremia. These are classification of hyponatremia based on volume status. And this classification all come under one umbrella, which is hypotonic hyponatremia. So now, we now look at this classification in depth. Let's begin with hypovolemic hyponatremia. Now, hypovolemic hyponatremia can result from either extrarenal causes or renal losses. Hypovolemic hyponatremia can be caused by extrarenal losses of sodium or renal losses of sodium. Now, we begin with the extrarenal losses. Now, extrarenal losses of sodium are losses of sodium that are from other routes, not through the kidney. Those are extrarenal losses of sodium that will now result in the individual having hyponatremia. Now, these extrarenal losses of sodium that results in hypovolemic hyponatremia include vomiting. When an individual vomits, in the process of vomiting, the person is losing electrolytes and is losing sodium. So when he's vomiting, he's losing electrolyte, he's losing sodium. In that situation, he's also losing volume. So remember that we're talking about hypovolemic hyponatremia. So volume is low and sodium is also low. So as he's vomiting, he's losing fluid and is losing electrolyte, including sodium. So in that situation, the person has low volume, a reduction in blood volume, and at the same time is also having reduction in sodium concentration. So another cause is diarrhea. Diarrhea, when somebody is passing stool as well, is losing a lot of electrolytes and is also losing fluid at the same time. So diarrhea can cause hypovolemic hyponatremia. A state of dehydration also can, in a way, cause hypovolemic hyponatremia. And then burns. When somebody is having burns, maybe fire incidents catches up with an individual and the person burns, the person loses um, um, is losing because of the opening on the skin, because of that burns on the skin. If you have ever been around somebody who had burns, you see that they're always changing the wounds, dressing up the wounds because the person keeps losing fluid, losing plasma, losing plasma, losing plasma. Those sticky fluid that is coming out from people who have burns, they are losing plasma. So in that situation, the person is not just only losing fluid, it's not just only losing plasma, the person is also losing electrolytes. So in that situation, when you measure electrolytes in that person, measure sodium in that, collect sample from that individual and measure sodium, you see that there's low sodium and there's low volume in that individual at the same time. So that is hypovolemic hyponatremia. Then also bleeding. When somebody is bleeding excessively, maybe the person is having heavy menstrual bleeding for one reason or the other, or the person has an injury and it keeps bleeding and bleeding, the person will be losing volume, will be losing sodium at the same time. So these are things that can cause extrarenal losses of sodium. Then we now come down to um renal loss. Now, renal loss is loss of sodium through the kidney. And when the individual is losing, because it we're talking about hypovolemic hyponatremia, that individual is losing fluid and is also losing sodium at the same time. Now, this can be seen in the use of diuretics. Maybe the person is taking diuretic medication. Remember what we said about antidiuretic hormone. What does antidiuretic do? Antidiuretic conserve fluid. So if antidiuretic conserve fluid, that means diuretic medication, what do? They allow fluid to go. So when somebody is on a diuretic medication, that means the person is on medication to cause loss of fluid. And at the same time, as the person is losing fluid, is also losing sodium, because you know that sodium and fluid they go together. So when the person is losing water, is losing sodium. When you measure, take sample in that individual and measure sodium concentration, you see that the person will have low volume and the sodium concentration of that person will also be low at the same time. Then also, um, another thing too that can cause it is tubular necrosis, maybe a disease that has affected the renal tubules. So with that, you know that normally sodium will flow through the glomerulus and water will also flow through the glomerulus freely. So in the glomerular filtrate, you will find sodium and there is also fluid. And you know that it is in the tubule that sodium will be reabsorbed. At different parts of the tubule, sodium can be reabsorbed at the proximal convoluted tubule. It can be reabsorbed at the distal convoluted tubule. Sodium can be reabsorbed at the collecting duct. Sodium can be reabsorbed even at the loop of Henle. It's just that the reabsorption is in various degrees in these different parts of the tubule. So if there's a damage to the tubule or there's a disease affecting the tubule, that means reabsorption of sodium along the tubule will be impaired. Reabsorption of sodium also, of fluid, water also along the tubule will be also relatively impaired. In that situation, the individual will be losing fluid and will be losing sodium at the same time. So you see that there will be hypovolemic hyponatremia. Now, these conditions, both extrarenal losses and renal losses, they deplete the total body water and also deplete the total body sodium. And there will be a reduction of the extracellular fluid volume as well. Now, the difference between identifying extrarenal loss and renal loss is that when you measure sodium in the urine of an individual who has extrarenal loss of sodium that has caused hypovolemic hyponatremia, sodium will be low. Sodium will be low. But when you measure sodium in the urine of an individual who has renal loss of sodium that has resulted in hypovolemic hyponatremia, sodium concentration in that urine will be high. So that's the difference. That's how you can easily differentiate. You want to know whether an individual, you have established that an individual is having hypovolemic hyponatremia. You want to know whether it is mainly due to, when apart from symptoms, you have seen the symptoms, but you want to really confirm, is this due to extrarenal loss or renal loss? When you measure sodium in the urine, sodium will be high in renal loss and sodium will be low in extrarenal loss of sodium.